Aloha, good morning.
Aloha.
Or whatever time you're watching
Yes.
this. I mean, good morning for us.
Yeah.
So it's time for an update again. You've all been asking, which we appreciate. We just wanted to get all our information in order to be able to update you guys. Go for it.
How many times have we done that?
I know.
So the long and short of the back and forth is right now, surgery is not happening. And we switched to monitoring. We don't know for how long. It could just be till the next MRI, which could be a month, or until something happens.
So to kind of give you all an update, as you know, the surgery kept getting delayed, canceled, denied by insurance. And one thing about having me in your court and Ed is we're both experienced in getting stuff done when it comes to healthcare. I made sure that even while they were dealing with the insurance, that additional MRIs were getting ordered to watch Ed. And that led to some extra bits of information. Talking to the surgeon the other day when we were still having insurance issues, I believe your surgery was supposed to be yesterday again.
For the fourth time.
Yep,
yeah.
They had 2 additional MRIs since your seizure. And when he looked at the MRI from your seizure, he said, yes, surgery, it looks like recurrence. But as they started to get to know you and learn your history and see your symptoms or kind of lack thereof neurologically, and then seeing the additional MRIs, they realized it might be looking more like radiation after effect than it is recurrence. Although often they said there's a combination of both, but where they thought this, massive explosion on the MRI was recurrence, they're thinking it's probably safer with your markings, your history, your symptoms to watch and wait, and having the surgery delayed made us re-examine that. So I feel good about the care team you have here and the fact that in the mix of all this mess, they got to know you better as a patient and start to assess you as a patient.
Yeah.
It's terrifying to have canceled your surgery when it was something that imminently needed to be done.
For the fourth time.
Mm-hmm.
So yeah, that's the long and short of it. It was a million times going back and forth, and there's still that part of you that says, should we just have done it? But the doctor kind of say right now, give it another scan, and maybe it isn't worth pursuing the surgery right this moment, because what if it's our one shot to get it done? But so yeah, I think there's, at least for me, there's a part that's going to be, should we just do it? Should we just do it? But if the doctors who are the actual experts, because we are not, say, maybe it's not as urgent as we need to at the moment, then...
Also, don't forget the component of what we are professionals in is ourselves. And we ramped up preoperatively 3 times to have it canceled 3 times on the heels of that. That was taking a toll on us. And I would agree that I was probably more... excited's not the word, but relieved to hear that we can wait, because I didn't think I could take a delay and ramp back up to be your caregiver. That takes a toll on us, and that's the part. This time around, the surgeon actually called us because he wanted to discuss the newest MRI that you had just done a few days ago and talk about this option, and I felt like that held a lot of weight to it, is because it wasn't just the doctors, he actually called us and sat down and explained everything about why he changed his decision. He's not the first person who said that. We've had, as all of you know, teams around the country reviewing your records, and nobody, once they had the whole package there of all your scans, was keen on jumping right in with surgery yet. And I think it took a moment, because they saw you at your lowest when you came in with a seizure, to coming back to your baseline here, it was harder for them to make the decision, but everyone agrees. Surgery, minimally invasive or not, is still invading your brain. It has risks. It has, you probably will have side effects from it after, because they're damaging brain tissue on purpose to protect you. So they felt it just wasn't worth that now, that the benefit wasn't there.
That's the current opinion. So I guess right now we are wait, monitor, watch, hope, and that's it.
Yep, and trying to live every day, every week, every month as we can, because the one thing we've agreed to with the doctors is the moment they think surgery might need to happen, we're ready to go with it.
It hopefully also gives us a chance to get a COVID vaccine, so that that's not something we have to worry about when I'm recovering, is, oh my gosh, am I also maybe going to get COVID and
while in the hospital. I can't
Right.
imagine they put a mask on you. Although the hospitals here are great about that. Preference would still be when you were voluntarily like admitted, where you took yourself in for follow-up, you wore a mask while you were there.
Sure.
I can't imagine post-op they put a mask on you.
No,
Probably not.
yeah.
So, it's
that's
just extra risk.
right.
Taking more risk off the table right now for us is a good thing. And waiting is safe right now. Everyone agrees on that.
Yeah.
It's still
That's-
scary, but
That's kind of what it is. I mean, it's a short update because that's the news. Is that
The
right
news is
now
no
it's a
news.
pause.
We stopped.
Yeah.
Yep.
So that's okay.
Yeah.
So that is where we are.
so hopefully we get vaccine soon, like you said. We can get doing a little bit more exploring of our island here. We've been enjoying some just time by ourselves, exploring outdoor spaces away from people because it's still a risk for us.
Yeah.
But yeah, we're doing well, I would say. It's been ups and downs emotionally.
Oh, yeah.
We've built that strength that we shouldn't have had to. But overall, your comments that you've all been reaching out, we've responded sometimes that it's kind of a lot to explain and wait for this update video. We weren't making you wait to like keep you hanging. It was we were trying to understand everything for ourselves to then be able to digest it and share it with
Yep.
you. So thank you for your support. Thank you for your patience in waiting for this update. And as always, we'll keep you updated. Hopefully make some more fun videos
Yeah,
as we get vaccinated.
that'd be nice.
Yeah, it would be nice to go back to what we like doing.
Yeah.
And then when the time comes for treatment updates or anything like that, we will let you know. And right now we're still facilitating all those clinical trials, finding out where you might go when and if. And that way we hopefully won't be caught off guard should something change and we have a lot of good doctors behind us as well for when something happens now across the country.
Yep.
So now it's just waiting and watching.
Just staying abreast of the situation, talking with doctors, and that's all we can do.
Yep. So from Hawaii to all of you out there, aloha and
Aloha.
have a great rest of your weekend or whatever day it is you're watching this.
Yeah.